Say hello and welcome to our Health System Analytics Design Challenge interactive webinar. So today we are hosting an interactive session to get you acquainted with our design challenge process and connect you into our Colleaga community filled with helpful resources for filling out your submissions. So I'm Katie McNeil and I'm going to be your host today. As you saw at the beginning as you were walking in, we have Dan Gordon on the call as well, board chair of Colleaga. And we also have George Watt on this call today. He's one of our members, our expert members of our Colleaga faculty, and he'll be helping lead some of the discussions that we'll be having later on in the call. And lastly, I'd like to introduce you to our fabulous innovation Sherpas. They're who you can reach out to in the chat if you have any technical problems during our call today. So I'm sure we're all Zoom aficionados at this point, but let's go over just a few ground rules for our meeting today. It is an interactive webinar, so we do ask you to leave your video on throughout the call. Connection and interaction is really core to Colleaga, so that's why we encourage you to interact as much as you can. We also ask that everyone leaves themselves on mute. This is just to reduce the background noise, but obviously unmute yourself whenever you'd like to talk. So today's session will be recorded. We will be distributing the recorded footage after our meeting today. So if you have to step out quickly, you'll always be able to catch up on whatever we were talking about. And so we're looking at about a 1-hour session today, during which we'll provide you with an in-depth explanation of our design challenge process and how it can help accelerate your innovation ideas. We'll also be hosting a little section at the latter half of this webinar just to get you into the Colleaga community by interacting with the other participants on the call here today. One thing I forgot to mention is that I mentioned the chat function earlier. I'll just redirect your attention to it at the bottom of your screen. I believe Michiko posted a little chat message for you. Michiko is also who you can reach out to if you have any questions throughout the session. So essentially today's webinar has one key purpose, which is to answer all your design challenge questions and provide you with all of the collaborative tools that we offer to help you create the strongest submission you possibly can. So with that being said, I'll pass it off over to Dan to explain who Colleaga is and what our collaborative vision is. Over to you, Dan.
Thank you, Katie, and welcome everybody. And welcome particularly to those people who are coming back and who have been to our webinars before. As you all know, what we're trying to do at Colleaga is build a network of cooperative mission-based innovation programs that bring together public, academic, and industrial innovators to collaborate on complex social problems. Our members are health and social system professionals who are working on the front lines to improve wicked challenges. They're the inventors and the creative experts who are building out the products and who have the ideas. They're the entrepreneurs who can collectively see past the status quo to the possibility of a new future and work out how to commercialize inventions. And they're the investors who are doing old things in fundamentally new and different ways. We're also delighted to be bringing Colleaga Capital, that's our newly launched impact fund, to our community as another vital tool for innovators on their path towards commercialization and sustainable financial success. These Colleaga design challenges are designed to find and reward selected Colleaga community members with impact funding for bold entrepreneurs with companies and for eligible consortiums. They will provide not only funding but membership in our innovation accelerators, access to our toolboxes with their capabilities to broadcast success to our supportive community in order to gain their support and mentorship. We are part of this amazing wave of community learning and generous global collaboration that we're seeing around us during the time of the pandemic, founded on our shared belief that together we're smarter than we are alone. And the more that we can help our partners to succeed, the more successful we will be as a result. So welcome to our session.
So I'd like to take a moment now to just get you immersed right into the interactive elements of our webinar today. And we're actually going to introduce you to the Health and Social Innovation community. So the Health and Social Innovation community is a space where you can share your project ideas and see what other projects community members are interested in working on. So while it's not the actual space that you'll be using to submit your project briefs, it is a great space to connect with other innovators and our faculty of mentors and experts. So we have provided everyone on the call today with an innovation community account. And we will be walking through a little activity. So if you find after the activity that the innovation community isn't going to be particularly useful to you, you can always delete your accounts or send myself an email asking to get it deleted. But what we do ask is that if you're not finding what you need in this community, please let us know, because it is an experiment in community building. So we want to try and gear our community to the needs of what everyone wants. So with that being said, Michiko has shared a link to the community in the chat. Please go ahead and open it up and head over to the sign in page. To sign into your accounts, you will need to use the email that you registered to this event with. And you need to use a temporary password that we've provided you with. I have the temporary password up on the slide now, and we've also included it in the chat, so you can copy paste if you like. So I'll give you a few quick moments to head on over there and log in. Again, if you have any questions, please put them in the chat and our Innovation Sherpas will help you out and answer them. And if anyone joined our call a little late and we didn't have a chance to register an account for you, I'm actually going to be walking through this activity as well myself on screen. So you can follow along with me. For those of you that have gotten logged on or are getting logged on, I would recommend that what you do is split your screens so that on the left hand of the screen, you have our Zoom call and you can follow along with me. And on the right side of your screen, you have the Innovation Community webpage. So if you want to quickly turn your attention back to our Zoom call, you'll see a format that I recommend. I'm going to get logged on myself now, and I'll give everyone a few quick moments to arrange their screens as they like and get finished logging on. Okay, so let's get started now. So this is the Health and Social Innovation community. It's a space you can come to find interesting videos that we're posting, articles that are being shared. You can also find all of the upcoming events that we'll be offering, as well as it's a space you can also come to view the current challenges that we have running. And you'll also have access to all of our faculty of mentors and experts and all of the innovators that we already have in this community. So what I would love to do today is introduce yourself into this community by making a small post just with some interesting facts about you and why you joined us today. So if you go to that main feed, you can see I've made a post, and if you click on it, you can open it up. And I've asked you a few questions that I'd like you to fill out. So I'd love to know, what is your work, what you do for work, what health system analytics experience or expertise you can contribute to a team, what you hope to receive from doing this challenge. And if you have time, you can throw in one thing you enjoy doing when you're not working. To answer the questions, what I would recommend you do is you go ahead and actually copy and paste all of my prompts here. And then you can go right to the bar at the top of your screen and plug them in, and then fill them out that way. For anyone who wasn't able to log on or had trouble logging on, Michiko has also shared all of the prompts in our chat. So feel free to answer the questions that way. And then we'll actually, our Sherpas will copy and paste them into the innovation feed here. So it's just a quick way to introduce yourself into the community. If there's something that you don't have time to fill out right now, you can always come back after the session and edit your posts, or if there's something you want to change or amend afterwards or elaborate on, you can always come back and do that later on. So it's just a quick, just take some time now to quickly fill out your answers. I'll give you about 2 or 3 minutes to fill those out, and I'll read some of the ones that I have coming in while you're filling them out, just to get a quick sense of who's on the call today. So please take a few moments now. So as you write, I'll just let you know that we do have our own Jessica on the call today. She's an innovation consultant here at Colleaga. And she's actually right now working on a veterans mental health accelerator powered by Colleaga. So today she's actually very interested in looking for predictive analytic and algorithms that forecast supply and demand in the clinical supply chain. So she's looking to find new solutions, particularly related to enhancing the mental health supply chain through the use of predictive analytics. And Jessica enjoys hiking when she's not working. So this is a great way to kind of get yourself out there into the community. People can see who Jessica is, what she's interested in, and what she enjoys doing, which is hiking. We had some beautiful hiking weather this year, although with the unfortunate snow that's been coming, I think we're running out of hiking time. But it's great to meet you, Jessica, and welcome today. So that's a little sense. I don't know if we have any Zoom answers here. But that gives you a sense of how you can use this community to introduce yourself. And if you are, if something in someone's post does interest you, you can always share your thoughts right underneath their posts and start a little dialogue with them. So I'll leave that there for now. If you are in the community, you can minimize your screen. There is something I'll be pointing out to you later on in the call today, but you can turn your attention back to the Zoom meeting, and I'll leave it to Dan to continue on about the challenge.
So thank you, everybody. Let's get into the meat of our design challenge. You know, over the past few months, as COVID-19 has nearly shut down our health systems, we've seen that data-enabled health tech, and particularly virtual care, have gone completely mainstream and have been adopted at a scale that we've never seen before. By one estimate, virtual visits comprised 70% of total US ambulatory care visits in April this year. Not surprising, given that offices were completely shut down. From June last year until June this year, US telemedicine claims have risen by over 4,000%. Clearly, telehealth and virtual visits are on the upswing. And when you look at what's happening in the investment environment, the pandemic has led to massive investments in data-enabled health tech, which includes three categories: the on-demand healthcare, research and development catalysts, and wellness and health maintenance. So let's look a little more closely at those three categories. Firstly, the rise in telehealth visits has created the demand for on-demand healthcare services. And that category includes companies that offer not only traditional one-to-one patient to provider telemedicine interactions, but also technologies that enable both synchronous and asynchronous delivery of healthcare from a remote clinician to a remote patient. Top funded value propositions just in the last quarter of 2020 represent $2 billion in investments. And these are for healthcare tech companies that are not in the traditional telehealth mold. It's for those companies that are integrating telemedicine touchpoints with continuous remote care. They're disconnecting themselves from labor-intensive one-to-one delivery of traditional telemedicine, and they're incorporating sophisticated analytics for population-based understanding, for demand prediction, for scheduling optimization, and for billing interoperability. Companies like this are offering prescription delivery. They're offering at-home urgent care. And those are enabled by virtual care services. So that's, for example, Alto Pharmacy, which offers consumers free prescription delivery with advisory services, raised $250 million 2 months ago. Roe, which offers virtual consultations for home delivered prescriptions, raised $200 million. And Amwell, which has got a telemedicine platform for a broad range of services, raised $194 million. In Boston, Honor, which is a home care company for virtual home care, raised $140 million. And right here in our backyard, Maple raised $75 million from Loblaws to build out consumer-based care with Shoppers Drug Mart. So consumer adoption and investor dollars are signaling the shift towards healthcare business models that are not focused on telemedicine, but use telemedicine as an enabler to achieve specific population health outcomes. They are focused on greater efficiency and particularly on better access to general or specific healthcare services. And they offer a range of options from self-care through to virtual touch points, through to one-on-one delivery across the care continuum, either for general services or for general chronic disease management, or for specific diseases like diabetes, cardiac care, and the relatively new kid on the block is mental health. Actually, regarding the concerns about lockdown-generated tsunami of mental health disorders, there've been a spate of innovations released into the market claiming to help with mental health conditions. And that caused the Federal Drug Administration last month to release guidance saying they did not intend to object to the distribution and use of computerized behavioral therapy devices or other digital health therapeutic devices for psychiatric disorders that otherwise would have had to undergo a formal regulatory review. And several companies have taken advantage of relaxed regulations to release psychiatric digital health products, including AKIL, which has released EndeavorRx for ADHD. Pear Therapeutic released a product for schizophrenia. Orexo has got a depression-related products. Vidya is looking at alcohol use, and Oxdio One has got a digital product to avoid opioid use disorders, because we should not forget that along with the pandemic, the opioid crisis continues unabated and is getting worse. All of these on-demand healthcare businesses are possible only for data-driven companies who are building data collection into every touch point. They are aggregating that data. They're developing artificial intelligence and machine learning algorithms to analyze the data and identify patterns. And they're driving consumer and clinician decision-making with good data. The second most funded value proposition is for life science companies who are focusing on research and development catalysts. Those are companies that support drug discovery and clinical trials management. This year, they have seen investments of $1.3 billion in this last quarter across 25 different deals, with an average deal size of about $50 million per investment. And these clearly are companies that are driven by data analytics that find patterns in large genomic and clinical trials data sets. And considering the race to develop vaccines and treatments for coronavirus, they're adding efficiency, precision, and speed to drug development, and that feels like more urgent than ever. In fact, many of the companies in this category are developing COVID-19 vaccines and treatments, like Xtapi, who's using artificial intelligence to screen existing drugs that may be able to treat coronavirus, and Atomwise is creating the collaborations with research centers and universities to develop coronavirus treatment candidates. And the third category is for companies that are focused on wellness and general health maintenance. There's increased demand for companies that are looking at the promotion of fitness, nutrition, and sleep. And this is a continuing trend over the last several quarters. These companies have received $1.2 billion invested across 21 deals with an average deal size of $60 million. And generally, these companies use wearables or point of care to stream data from multiple users in real time. And their focus is on social technologies and data aggregation and on specific population intelligence as their core technical capabilities. These are companies like Zwift, which raised $450 million for interactive fitness entertainment platforms. That's related to indoor cycling for the cycling enthusiasts. They're competing with Peloton. Tonal raised $110 million for intelligent at-home strength training. And Whoop, which is a Boston-based wearable and tech analytics company, raised $100 million for their platform. In the same vein, ClassPass raised $285 million for a monthly fitness membership program. So those are the kind of companies that are in the health and wellness space. And so the mega deals are showing us where the market is going. It's towards, it's across the continuum of care and towards prevention innovation through wellness and health maintenance and wellness. It's for diagnosis and treatment innovation through R&D catalysts. And then it's care anywhere, anytime with on-demand healthcare are the three main categories of health tech deal making. But the mega deals are also illustrative of the considerable venture and public financing for scale-ups and startups. At the moment, there's about 100 million that is available through the Canadian superclusters and mini clusters. And there are $50 million tranches through the US innovation clusters in Colorado, focused on Boulder and Denver, the Rust Belt states centered on Ohio, along the Boston-New York corridor, and of course in California, between the combination of Silicon Valley focusing on health tech and San Diego on biotech. All of these centers have got early stage public financing opportunities ranging from $50,000 on the low end through to about $1 million on the high end for startup activity. And then there are the customers for these companies. Pharmaceutical companies investing in R&D catalysts, along with research organizations, and all the health payers and the health systems and the hospitals who are buying solutions for specific healthcare settings or for specific programmatic focuses like virtual cardiac care or diabetes, and as we said before, mental health coming on stream. So healthcare innovators working in health tech or in any of these broad categories have got huge opportunities for customers, funders, investors, and partners to help them gain traction. That's the good news. On the risk side of the equation, most of the health tech companies in the startup space will not succeed, and they will not get funding. Because what is common about all of these innovation opportunities is they all require of healthcare innovators to have a mix of advanced soft and hard skills, the equivalent of doing 3 PhDs simultaneously. Because if you're in the space, what you need is to have a combined understanding of healthcare, clinical knowledge, and the capabilities to develop advanced analytics. You need expertise in building workable consortiums that nurture collaborations between public, academic and private interests to solve complex problems. You need to understand the startup business and the disciplines of innovation. Of course, you need access to advanced technologies and the ability to easily and quickly assemble infrastructure components together so that you can focus on the specific problem that is your focus and passion. You need to be able to develop traction to get the financing to bring innovations to sustainable fruition. And you need to have great communications and storytelling skills to translate this complexity into simple stories on the spectrum from one-on-one conversations all the way through to one-to-many broadcasts across networks in order to be able to generate interest and traction. Doing all of this together is a very tall order for anybody. Healthcare innovators need supports in order to be able to succeed. And so these are the attributes that we're building into the Colleaga innovation ecosystem. That is our combination of our accelerators, our impact funds, our community interactions, and our global network connections. So all of Colleaga is designed to support healthcare innovators in these areas. On the next slide. In our innovation accelerators, teams of innovation fellows follow disciplined, structured processes from problem definition to solution identification and planning to learn not only how to structure this process, but also how to use it to develop complex problem understanding with multiple stakeholders. We are developing, as we speak, a Colleaga living laboratory to provide healthcare innovators with innovation infrastructure that supports privacy compliance and secure access to anonymized data and data utilities and artificial intelligence and machine learning tools and advisory supports. We're developing the Colleaga innovation community that you're participating in today. We're recruiting expert mentors and partners and publishing evidence and articles about not just about telemedicine, about virtual care and about analytics, but also about innovation best practices. And our knowledge bases are designed so that we can share knowledge with each other. We're also developing our network of globally connected innovation accelerators. And so we're delighted with the accelerators that we're hooking up with in Latin America, in Africa, and in North America, Europe, and Asia. So that we can broadcast our stories among our network to a much wider audience of partners, influencers, and potential customers. And we're delighted that Colleaga Capital, our social innovation venture capital fund to finance innovations that we're finding through our accelerators and challengers, can make a real difference in the way healthcare is delivered. So that's why we are hosting the series of pandemic recovery challenges, to create and nurture these collaborative consortiums that relate virtual care with health system analytics, testing, tracing, and on remote workforce transformation. And through the accelerators and our challenges and our community engagement events, we want to produce a portfolio of 100 ventures that are aimed at helping vulnerable populations who are adversely impacted by COVID-19. So that's why we invited you to this call today. Through this challenge, we're bringing together interested people, whether you are entrepreneurs, whether you're the solvers, whether you are participants in collaborations, whether you are entrepreneurs or investors, this is the home for you. And in keeping with our core values, we've designed these challenges not only to find a winner, but more importantly, as a learning opportunity to benefit all participants at every stage. So really, there are 5 reasons to participate in a Colleaga challenge. Firstly, you're a healthcare innovator, and you believe that this challenge will help you find the consortiums that you think are necessary, that connect your customers and your partners, that will be key to success. Or you're an entrepreneur and you're seeking funding, either through these competitions or through the proposals that are generated through the competitions or through Colleaga Capital. Or you think you'll benefit from active learning about challenges and innovation procurement best practices, and you will build expertise in the disciplines of innovation and in building workable consortiums to solve complex problems. Or you're looking for access to tools through our living laboratory and you think you need a toolbox of innovation infrastructure as a critical success enabler. Or simply you think that participating in a series of challenges is going to help you advance, and that you want to become either a mentor, a partner, an advisor, or a participant in a project, and you think that you can get access to different markets through our network of global innovation accelerators. Those are some of the reasons to participate. Whatever your reason is, we invite you to do it, and we have deliberately made it as lightweight and easy as possible. Just take the first small step. Just submit a proposal. See where it goes. So that's why we've made the first step of the challenge very lightweight and easy. In the first step, submit a pitch. The pitch could be for a project that you're interested in, or it could be for you. To say, look, this is what I'm interested in. This is the problem that I see. These are some of the solutions. And if it's a project, this is the project that I want to get going. And I have partners, but I'm looking for this kind of help. Or this is who I am, and this is my expertise, and this is what I can contribute, and this is the kind of project that I'm interested in, and we will try and match you up. We will also get back to you. Our commitment to you is that do this small piece of work, we will get back to you, or tell you what we think. For those people and organizations that make it into the second part of the challenge, that is when co-design really starts, and we will be creating workable consortiums, getting people together in the room and saying, whether that's virtual or we hope in the near future to be physical. And that's where we'll start to say, okay, we have a project on the go. These are the people who are interested in the project. How do we bring this project to fruition? What are the next steps? How do we participate, build consortiums? What are the key consortium members that we need, whether those are the leaders of the project, the clinicians who need to be involved in making those projects successful, the technology vendors who see that as a route to market, the academics who think of it as their test bed, or the investors who see it as an investment opportunity. We will bring those consortiums together, create those proposals in a short period of time, take them forward, and see where they go. And see where they go means let's see how we can make them successful, whether that is by presenting them to the target audience, getting them funded, presenting them to Colleaga Capital through the investment committees, seeing if we can get them funded that way, or presenting them to other proposals, to other proposal audiences to see if we can get traction in that way. So that's what this is all about. So collaborative design starts right now. I think that there are fewer enough of us to get started in one session without breaking into small groups. So let's get started with introductions. The little exercise we had earlier in the going on to the Colleaga Community Network was your practice session. So let me throw it out there, and perhaps Jay, may I ask you, would you mind kicking us off and telling us the little bit about who you are, what your expertise area is, what you would like to contribute, and what kind of project you would like to participate in, or what opportunity you would be looking for.
Good afternoon, everyone. My name is Jay Lynch. I am a registered nurse, and as you can tell by the receding hairline, I'm an old dog. I've been around for a while. I cut my teeth on implementing telemedicine programs in two of Ottawa's large teaching hospitals. And I learned a great deal about innovation and the pace at which it can move. So what brings me here is, I've been off doing other things. I've been working as a health informatics analyst. But what brings me back to telemedicine is the sheer pace at which things have accelerated since the pandemic began. I can't tell you, I just can't emphasize enough how hard it was to get change in hospitals pre-pandemic to actually get a patient seen by a physician was a monumental task that just took so much time and so many people and the good efforts of people to take a chance and pioneer. Long story short, I and my colleagues, this would probably be going back 10 years ago, I feel, or I believe that we set the groundwork for what is happening now, right across the board. So I'm back here to learn and to learn from you and to learn from a younger cohort of people who I think the time is right. I'm happy to share some of the lessons that I've learned, many of them the hard way, slaying some of the dragons that I had to slay during my career. And I guess if I had an area that I probably am better at is the whole communications thing and the importance of pitching your ideas and packaging them right, talking to the right people. So anything that I can share that way, I'm more than happy to do. So I don't know if that's what you were looking for, Dan, or
Yeah, absolutely.
yeah, there certainly is a lot going on out there. It's I see some duplication as well, believe it or not, and people potentially stepping on each other's toes, but that's another subject. I digress.
Okay, we're going to come back to that. Bina, welcome. Tell us a little about yourself.
Great, thank you. Thank you for hosting this, by the way. It's great to be part of a community like this. It seems like something that I've been searching for, and when I give you my background, you might understand why. So I'm actually a management consultant by background. I do have an MBA in health services management, and shortly after I graduated, and this is going over 15 years back, actually, I did join one of the major consulting firms and worked in their healthcare practice. I've kind of traveled across a few of them, across IBM, Deloitte, and Ernst & Young, always working in either the healthcare or public sector practice, and always having that healthcare background. So in terms of my experience in analytics, my key clients have been either the government, so the ministries of health, largely across Canada, and as well some of this healthcare delivery partners. So some of the major academic centers in Ottawa, also in Toronto and other parts of the country, and some of the health regions as well. A lot of the work that I initially did was around conducting operational reviews. So that's where a lot of exposure, leveraging the existing healthcare databases in the system and at the provider level, and really kind of doing kind of a resourcing analysis and balancing of resources across the organization. So great work, really got immersed into that. I slowly kind of got, I will admit, a little bored of doing the same thing and seeing that it was very much focused on incremental operational results. I really wanted to work in an area where I could really see impacts and transformation. And what I'm talking about is impacts not just in healthcare delivery, but actually in bettering health and well-being. And so I extended my experience into the social services sector, thinking, I would get embedded more into those determinants of health, working in the social assistance program, so the vulnerable populations, child welfare as well. Again, working for governments and working in the firms, you tend to be more focused on the process improvement, enablement, cost containment, controls kind of work. So I didn't quite achieve my ambitions of creating those sustainable long-term trajectory impacts that you would see in a population. I got introduced to the world of social impact investing, and thought this was like completely aligned in terms of my ambitions and where I kind of had the vision how I can best utilize my skills. So won't get into so many details of that, but have worked around in Africa, I should just say, is really in Africa, but it was an international project in that space. So very fascinated with it. I'm excited for that space to kind of grow in Canada. One other thing, actually, as much as I criticize some of my experience at the firms, I actually was involved in a global initiative where they were developing a predictive analytics tool for healthcare programming. The use cases actually were in child welfare, and as well as helping to address the opioids addictions pandemic that was crisis that was happening across North America and actually across Europe and a lot of other jurisdictions. And the challenge with that is that I really do, and it might be biased because I really have been embedded in the governments in my career. They are really kind of the central figure to kind of mobilize a lot of these innovations and solutions. And they're interested. It is so hard to penetrate for them to adopt and for it to be really absorbed into the systems where they need change. It will eventually get there, and I hope to be one of the pioneers to help push that through. So I am now independent. I'm working somewhat in the impact investing space. I still work in healthcare consulting or government consulting in the traditional form that I described before, but really looking to grow the space. So I am kind of acting as an investment intermediary, helping organizations, startups, healthcare organizations that are using data analytics or just different types of innovation such as telehealth or even just device innovation to get capital raises for them, but then also provide the consulting services for them to scale. And then just one more other thing, just given my passion in this area, I realized I have a lot of domain experience, a lot of business skills, facilitation experience where I was lacking. And as I realized when I got involved with that advanced analytics project, my technical knowledge was lacking. And so I am currently pursuing a government analytics certificate at Johns Hopkins University to help supplement and round out my skill set in that area. So thank you for the opportunity to provide an overview of myself. Yeah.
Fascinating background. Welcome. Esmat?
Hi there, thank you. So yeah, my name is Esmat. I'm part of a small startup out of Edmonton, Alberta. It has been a result of extensive research and development from the University of Alberta. So we spun out February of this year. We predominantly work in the area of digital healthcare and telemedicine. So what we have is a twofold plan of creating a virtual clinic and then moving into a smart clinic initiative. The virtual clinic version that we have right now, we've deployed into one clinic in a rural area. And pretty much what we're trying to do is utilize current devices that are out there off the shelf, connecting them to our platform and taking patient data, utilizing the patient data and creating alert systems for them during a visit. So the visit is done remotely, and even without a visit, if a person is taking all these measurements, alerts are created, creating basically having a focus on a preventive and early intervention type of model of healthcare. Moving forward, we're trying to utilize the data that's collected into creating predictive modeling systems and we're using the advanced data analytics at the moment to create early intervention alerts, but at the same time, we're trying to use to look at the trends and how they're moving. So the reason why we're here is first of all to meet a great community that pretty much has the same thought or probably aim, and also it's in order for me to understand what kind of things are out there and what kind of needs could be out there. Because in being from a research and development group, and now we're moving into the business world, we're new, we're not very much used to it. So understanding the general trend, speaking with great individuals like yourselves, it brings a greater understanding. And as part of being a startup, my team is always looking for a higher paycheck. So if I do run into a pile of investors, that would also be great, but it's not the primary focus. So yeah, that's a short summary on myself. Thank you.
Amazing. That's great, and it's fabulous to meet you, Asmat, and more power to you, man.
Thank you.
It's we all know it's a hard route. You know what I'm going to suggest? Uh, we're going to live what we talk about when we say build a and start building a collaborative consortium. And Esmat, if you're okay with it, let's do that around the startup that you're involved in.
Yes, yes.
Do you mind telling me what's the name of it?
The name of it is Naiad Lab Inc.
Naiad
I
Lab.
can
Great.
put it in the chat if you'd like, because it's
Great, please do.
from the
So-
accountant to the lawyers, everyone is confused about the name. So
So I'm going to call on different people on the call today, and I'm going to ask you a specific question, if you don't mind. And please answer it, but then also add any other color. And let's assume you've got one rural clinic at the moment, and a next good phase of growth for your company, for Naiad, would be you've got a whole bunch of clinics going, and you've got a business model that's starting with that you're getting to product market fit.
yes.
Jay, in your experience, what's ahead of Esmat and his team as he goes through that journey? When you think about and you said you've got scars, what are the scars that you can talk to that you think would be relevant to Esmat to hear about?
Okay. There are several that come to mind right away. I guess, as Matt, I would say that these comments that I'm providing are given in a spirit of trying to assist you. I really am not in a position to comment because I really don't know much about your business.
Agreed, yeah.
So I preface everything I say with that. Take it with a grain of salt because I'm just speaking off the cuff. But I guess the first question I would invite you to ask yourself is what makes your idea or your product or your service different from your competitors? How is it better? What are you going to do better than what the rest of the world is already offering? Another lesson that I learned the hard way is things always take longer than you think, and they take more of you than you think. But probably and I don't want to go on too long because there's others with a lot of experience, is I would invite you as Matt to fail as often and fail as fast as you can, because it will just save you time. It will hurt, probably some of it, and some of the feedback will hurt, but in the long run, that truth will set you free to improve your product or your service so that you can go on and be competitive out there and make it worth all the time that you're going to put into it. And don't ever let anybody say that you can't do something. If your mind is made up and you're willing to keep doing what you need to do, you'll probably succeed.
Thank you.
That's Jay. I think that's very insightful. I think in two different ways. The one is what makes it different. As Matt, you just heard about as we were talking about before this, companies are getting funded in the hundreds of millions of dollars. And there are tons and tons of startups in this area, and there's a ton of virtual healthcare going on. So this question of how are you different? You're going to get that a lot.
Yes.
When you go to buyers. They're going to ask you that. Does something come to mind that you would say, well, you know what, we're focused on this and not on that?
Well, yeah, for sure. We've got that. We've had that question many times. I mean, in Alberta, we've had this Alberta Innovates, and I'm not sure how many people are familiar with any of that, but we've gone to Mexico through Alberta and Mexico Initiative to the U.S., and that question has popped out each time. The main thing, the couple of main things I would say is a lot of the products that we have explored, there is the telemedicine side and then there's the device side, and they're both kind of in a way disconnected from each other. There is the telemedicine, so it has a virtual consultation, but it's chat based, web based, and video based. Then there's the home care model stuff, which has very basic devices that you can take home and do virtual consultation from, and these devices can be blood pressure cuff, thermometer, things that you and I can use at home. And then there are other sort of ones, but where they tell you that if you put a watch on, they can take your ECG, your blood pressure, and it can monitor you and give you alerts. But they're not quite medical grade because, as we know, from the wrist, you can't really have a medical grade measurement of anything. So what we tried to do is we looked at all those gaps, and that's how we kind of came up with a product out of that research and development. The gaps were, we want to create a true medical grade virtual clinic. So having the rural areas connected with the cities, so tackling the big issue in Alberta of healthcare, which is the health inequity, for us to go from the rural area to the city to an indigenous community, it's like three different countries you're visiting with respect to healthcare and clinical provision. So with a low cost infrastructure, we're trying to reduce that health inequity. And basically, technologically, what it is that the kind of devices that we have connected are not just blood pressure, ultrasound. There's also glucometers, otoscope video feed, portable ECG, portable ultrasound, and a blood analyzer. So there's no need for the traveling of blood analysis or anything, can be done locally. And all of that information, the other big value proposition, they say, I've been beaten down by many people to call it value proposition, but basically what we try to do is we try to connect with the, excuse that, we try to connect with the EMR systems automatically. So whenever we collect all of the data that we have into the platform, we're not trying to replace EMRs, we're trying to auto-populate it, which from our research has shown that physicians are using, are doing overtime work using 320 hours per clinician per year, about there, give or take, on populating EMRs manually rather than having it done just automatically from the information that we collect. So all of that information is seamlessly collected and kind of shared digitally throughout the different organizations. And that ease of data, the data fluidity, and the part that it's medical grade, and with having the analytics layered on it, these are the kind of things we're trying to improve and see how that can increase the infrastructure in starting from rural clinics, moving into urban areas, and hopefully senior care facilities.
That's a good answer, Matt. I would sort of summarize it down to and I may be getting it wrong, but we're better than anybody else because it's a medical grade virtual clinic, and it's going to, because we focused on interoperability, we're going to save time for the docs, and you don't have to get blood specimens going around. So we're going to make the health system more efficient.
Mhm. Pretty much. There's a
That's
twofold,
getting
yeah,
to be able to tell the story very simply.
very
Because,
concisely. Yeah.
when you think about the investment perspective, the what do you think that, let's assume that, okay, SMAT and NIAID are getting traction, and now they're coming to, pre-seed. What are they going to be up against, and what can you speak about from your experience?
Actually, one follow-up question on that last piece.
Please.
Is the data integrating with existing EMRs?
At the moment, so we have tested it in lab. So in lab,
Okay.
it works.
Yeah.
But as we're deploying for the first 4 months, the clinics want to use it as a standalone.
Yes.
and then they want to connect to the EMRs. But we have
Yeah.
verified it in lab that it works with
Okay. And
different
then so
EMRs.
you've developed an integration layer to do that with the various vendor EMRs that are out there?
Yeah, with the different EMRs, that it's a bit of a tweak from going, let's say, from the AHS one, like the
Yeah.
Epic one,
Yeah. Yeah.
going from the Epic to Wolf
Mhm.
there's a little bit of tweak,
Yeah.
but in the end, the process itself is the same. So we have
Okay.
developed that layer. Yeah.
Okay. Yeah. Sorry. And I do ask that because that's actually another value proposition, because that is a key piece to have them integrated. So with that, you have another value proposition. So in terms of then approaching, yes, impact investors, it always, and are you pre-seed actually, or are you seed?
Pre-seed. Yeah.
Pre-seed, okay.
Yeah.
And I like working with pre-seeds actually. So pre-seed, so it will, okay, so there is, and it depends on the type of investor, and but definitely having that value proposition, the pitch, really concise and clear there, the data to support that. You kind of spoke of the business case of, you know, how it does save physician time. So I actually work in the area of not just any investors, I do work with social impact investors. So you need to show the financial benefits as well as the social impacts. So that money now can be reinvested from primary care into whatever else, and or it's saving the system this much money, it can be invested. So just kind of having that story there if you're approaching social impact investors. But I think you actually have a very good story for social impact investors. I have worked in the northern communities in mainly Ontario. It's a problem everywhere, actually.
Yeah.
So in Canada, and actually you probably could also pitch things into other jurisdictions in Australia. They face a lot of the similar challenges in terms of geography and access in like Canada does. So that being said, you have to show that your market is scalable. So it is that business trajectory plan. So your pricing strategy, and as well as your trajectory of sales, probably you're going to show Canada, Alberta first. I think the big markets are going to be BC and then Ontario, and, you know, and then to show the social impact, it would be good to show it in the other provinces as well. But then you look at your expansion plans internationally, and that gets a lot of attention, particularly from Canadian social impact. And depends. Some of them have an investment thesis that's mainly in Canada, and some of them. So it's aligning that the investment theses too, and that sometimes, and that's where you know, our role kind of comes in terms of just finding that alignment. Yeah, the last piece I touched on this, especially if you're approaching social impact investors, is starting to show your thinking on measuring that. So I think I actually kind of touched on that. So yeah, hopefully that gives you some ideas and advice there.
Thank you.
So thank you, everybody, and particularly thank you, Jay and Bina. And Esmat, more power to you, man. Thank you for being our case study of what we mean by being surrounded by a supportive community and working on collaborative innovation together. We did plan for this call to be an hour. Very happy to keep the lines open and to continue this discussion, and it's an excellent discussion to have. Before I pass it back to Katie, this is what it looks like to be involved in Colleaga. And in fact, Esmat, I was going to suggest that we've developed partnerships with the Mexican accelerator. What we would say is, when you're ready, we will take you there, pitch to them, because they have an impact fund as well. And similarly, and I think another opportunity, actually, I think for Bina and for Jay, is we are helping a group in South Africa to develop a national mental health service for the country, particularly focused on post-traumatic stress syndrome, among veterans, first responders, and especially their families. Domestic violence is a considerable problem over there, and so we have a partner over there who wants to develop this out, and he's looking for people to assist, advise, participate in doing that. And all of these projects are around, look, join a project. We can't tell you where it's going to go, but we can tell you that when you get hooked into a project, the objective of the project is to find out how it becomes financially self-sustaining. That is what this collaborative is about. It is about connecting people into projects and connecting together the contributing mentorship advice, and then finding out what our different roles are and which projects really spark our interests and our passion. Lots of different places this can go. What I would ask you, please, as I hand back to Katie, and she'll show you how. Connect into the challenge. Tell us who you are. Tell us that you're interested to continue a discussion in whatever form, and we will get back to you. And Aislinn, who is leading our community interactions, will get back to you and start taking you through a process to say, okay, let's see how we can connect you up. Let's see which programs we can get you involved in. If you would indulge me for just another few minutes before we go to Katie, another person I would like to introduce you to is George Watt. George is one of the Canadian hidden treasures in how to really do innovation. George, I'd like to just hand over to you for a minute or two to give your impressions to everybody on the call about what you heard this evening and where people might go.
Yeah, wow, I really had to hold my tongue because I know you were limited time, but I really liked all the input. I would say, as Matt, everybody says fail fast and break things, right? And I think if you change your perspective to learn fast and iterate, it means exactly the same thing, but it's so much less destructive than failing fast and breaking things. So I don't know if, Dan, I'd have too much more to add. I think it's all come out. I would have asked you about your value capture. So Bina talked about measuring the financial impact that you had. So are you going to grab a piece of that so you can eat every evening? I would then focus on traction. So who am I going? Where am I going? How am I going to get there? And if you're thinking of going internationally, are you going to if you move too quickly, are you going to spread your resources so thin that you never actually finish what you're like? Maybe you can move, maybe you can't, but it's better to be deliberate, I think. And thinking about the unfair advantage you have. So it seems like you have an abstraction layer across electronic health records that might be a little interesting and so on, but can you do what you're doing in a way that can't be easily bought or copied by someone as soon as you start to get famous, right? So how are you going to grab share, but then protect it? And there are a number of ways that you can do that. So Dan, those were I've got about 8 pages, as I usually do, of observations, but I think it's a really exciting thing that we've all got a stake, right? So I'm in Ottawa, as I think 2 of the other folks are. We all use a healthcare system, and when we see something exciting like this, it's sort of easy to get passionate about it and get behind it. So it was great to see that passion come out, not only in US Met, but in Jay and Bina and others who just learned about what you're doing 15 minutes ago. So I'm around as well and happy to be of help. But Dan, I hope that's what you were the kind of feedback you were looking for. But really excited. I wish you well on your continued journey.
Thank you.
Aislinn, please just give a wave out so people know you can put a name to the face. And Katie, back to you.
Yeah, so I'll just steal a quick few moments of your time. I'll just quickly walk through how you can actually go ahead and make your submissions into the challenge. So you can do that by going to our challenge webpage, which Michiko is sharing in the chat now. We also will be sending out an email after this webinar with all of these links and information included, so you'll have it afterwards as well. But to actually make a submission, you are going to have to create a Colleaga account. Sorry, my internet's just being a bit picky today. I guess it knows we're running a webinar. So you do have to go in, make a Colleaga account. Once you have registered all of your information, you'll then be opened up to a submit button. And that's where you can go in to put your pitch deck. We have a few questions that we ask you to fill out. So your name, whether you're submitting solo or as a part of a team, and then we ask you to do a brief description of your solution. Normally the creating account button is right at that top left corner. So you can go up there, and then once you've made your account, you have a list of options. So we have the FAQs that we recommend you go in and check out. We also have that submit challenge brief. You can also save your challenge briefs as drafts, so you can always go back in. The other thing is if at any point during this process, whether it be while you're actually creating your submission, or whether it be when you're going through the steps to actually get it in and submit it, you can always reach out and ask us any questions. So one of the ways to do this would be going into the community and going to that members tab and then messaging one of our hosts. So you can select any of them. We'll all be able to answer your questions. If you go in and say hello, you can begin a dialogue that way and start messaging. If you're more comfortable with email, that's totally fine. We also have an email that you can use, which is innovationsherpa@colleaga.org. Again, this will all be in the email. So we do encourage you guys to reach out. We're here to help you create the strongest submissions we possibly can. And the proposals are due by February 1st, 2021. So just make sure to get them in before that so you can get considered for the shortlist. So with that being said, I'll thank everybody for coming today. We will keep the line open for a little bit. So if you do want to stay and continue some of the conversations, please do. You're more than welcome to. And then, yeah, if you have any questions, get in touch with us and let us help you out. So thank you, everybody, and have a great evening.
Thank you, everybody.